Back to Medicopoint. Today we are taking two opposite but equally critical clinical problems, constipation and diarrhea. One is problem of blockage, the other a problem of loss. But both can signal a life-threatening emergency if not assessed correctly. Let's break down the key difference in their red flags and management based on Dr. Vaidya's clinical practice. First, let's talk about constipation. In an acute case, the most critical red flag is a potential intestinal obstruction. You must look for associated symptoms like colic pain, abdominal distension, or vomiting. In this situation, strong purgatives are dangerous and the patient may need a surgeon. For chronic cases, it's vital to investigate the causes. Is it lack of luggage in the diet or a side effect from common drugs like antacids or iron? Now, for the acute diarrhea. Here the immediate danger is not blockage but loss, especially the loss of fluid leading to dehydration. The critical red flag is severe dehydration. The first thing to do is assess the patient by checking for sign, low blood pressure and rapid pulses. The management priority is immediate rehydration escalating to IV fluid like RL. If dehydration is severe, it is crucial not to use 5% dextrose in this patient. So, let's put it side by side to make it clear. For constipation, the main danger is obstruction and the primary goal is to safely relieve that blockage. For acute diarrhea, the main danger is dehydration and the primary goal is to immediate rehydration. The management priorities are completely different, which is why a correct initial assessment is vital. If you found this clinical comparison helpful, please hit the like button and subscribe to Medicopoint. For more guides from this series, let us know in the comment box which topic would you like to cover in next video. Thanks for watching.